So can I answer that question? The answer to that question that I think Meta already is sort of building, and as is Uplift and a bunch of others, is something that makes me healthy. That's what all I really want. I want the killer app to save my life. That's it. Okay, so we have Oscar here tonight at PwC, and we have the CTO from this amazing new company that is going to change our world of healthcare insurance, is already doing it. So, Alan Warren, come on up here. We got your deck ready. Get your thing. And Alan Warren.
Thanks very much. All right, so we've got 15 minutes to drinks. I don't want to stand between you and that. We're going to try to go through this pretty quickly. Happy to be here this evening, and tell you a little bit about Oscar. I'm going to start with a little bit sort of context on the environment. You've been hearing bits and pieces of this all afternoon, I'm sure. We heard from Dan not too long ago about the challenges on data and user interface. All these things tie into what we see as a context for what's going on in the healthcare industry. And all that sort of paints a picture for why we started this company. So I'm going to give you a little broad context and what we're looking at. I'll talk a little bit about Oscar, the company, why we started it, and how we've built it to this point. And then I'll go into some pieces towards the end around what we're doing around customer engagement, around data that I think will be nice sort of tie points for the end of this. So it is the best of times, it is the worst of times. I think we all feel this in all sorts of ways. There is such opportunity right now for things to change, for people to start selling and providing insurance and healthcare to individuals. We're starting to push towards individualization of the large market, or the large group market. There's an opportunity to start interacting much more directly with the members from an insurance standpoint. But there's huge uncertainty out there, which we all get bombarded with every day in the press. And there are challenges on what's going on legislative front. There are challenges with whether the individual market is actually going to stabilize. I look at about a third of my job at Oscar as helping put blinders on my teams so they don't get distracted by all of that. We can't do anything about most of those pieces. All we can do is take the environment we're in, the mission we're on, and execute towards that. So mission for you, or guidance for your teams. If you can keep people focused and not distracted by the noise out there that you really can't do anything about, that's a huge value add for your teams just to start with. There are all sorts of opportunities around actually changing behaviors and changing outcomes. It comes down to being able to connect directly with members and get their attention and then encourage them along paths that are going to be better for them. There are enormous opportunities here, but there are also big players in this ecosystem that are not really anxious to change. They like their baked in 10% per year fee increase. They like the fee-for-service model. They have their built-in models for how their clinics are going to run. So there's a lot of inertia in the system. And if you really want to jump into it and change, you have to push, as Dan said earlier. There are a lot of opportunities, but there are a lot of barriers to actually making the system go in new directions. Then on the data front, we are bombarded with data. From an insurance standpoint, we have claims information flowing through. We have members' data bios and history. We have information coming back from providers around episodes and what was going on in a particular treatment in an ER and whatnot. We have all these opportunities to pull this data together, but as you've all been bombarded with, it is still so siloed today. Pulling that together is an enormous challenge. Trying to get out to the doctors and actually pull the charts and the medical records and the unstructured data, the visuals and the lab results and whatnot, pulling all of this together is enormously difficult. If you look at the long tail of EMRs out there and the number you have to think about integrating with to do sort of critical mass across your population, it's enormously challenging. But you have to pull all that together to actually have a complete picture of what's going on with these patients and your members and be able to provide them the care that you want. And then finally, this huge interest in actually engaging with the members. Everyone's starting to talk about this now. This is actually why we started Oscar as a company. The interaction with the healthcare industry has all of the various challenges to it, but insurers in particular have traditionally been stuck in this model where they don't get pulled into the picture until the tail end. You have some consumer out there, some patient, they have some episode. They mess up a knee, thank you very much. They have some sore throat, something going on with them. They go to the doctor, they maybe go to an ER, they maybe get checked into a hospital, and they have a whole set of things. The insurer doesn't ever get apprised of all of that until the tail end when the claim's coming in. And they get put in the position of triaging who pays what and how much and dealing with the money. And it puts them in very negative and adversarial position in this whole ecosystem. So what we did as a company in Oscar is we're trying to change that whole flow, pull us as the insurer forward in that picture where the member will come to us first. But getting them to do that is an enormous challenge. And I'll talk through some of the pieces we've done to tackle that. So who the heck am I? I've been at Oscar for about a year now. I was at IBM Research years ago. I've done a tiny startup here in Manhattan, done the 2 to 60 thing right around 9/11. And then I was at Google building consumer apps and systems and infrastructure for close to 12 years. I joined Oscar about a year ago. And the reason why I did was multiple. But at the heart of it, it was the opportunity to take and use technology to fundamentally change and improve something that was desperately broken. We've all had episodes, either directly or with our family members, where we've experienced pain in the system, from just going to the hospital and having all of your records scattered and not being able to pull all the data together, to getting an EOB at the end of it and trying to decipher what's going on with your bills. The whole system is broken, but very entrenched and very difficult to move. At Google, I actually was running engineering for Google Health. This is back around 2007, 2008. And what we were trying to do at that time was pull together those personal health records. We all want to have this coherent history of all of the things that have happened to us, the medications we've taken, what happened to us when in our history, all the ongoing conditions and historical conditions, and be able to push a button and give that to a doctor when they ask us to fill out the stupid form when we get checked in. We all run into that every day. We were trying to tackle that at Google Health by doing integrations to various providers and partners and pull that in for the consumers. But Google was not an insider. They're sitting outside, they're working on behalf of the consumer, but they have no bespoke connection to the healthcare industry, or did not at all at that time. So they were trying to reach in and convince the hospital systems, the pharmaceutical companies, all these different parties inside that have all of that critical information, to give it to them so that the member could manage their own record and then control who can access that. Trying to do that from the outside is impossible. It was pre a lot of the legislation that's happened since, that's encouraged a lot of information exchange and standardization, and it was working from outside the industry. And the thing that attracted me about Oscar is that Oscar sits in the middle of this whole ecosystem. It's at the heart of it. It gets all of the claims information coming through. It has a handle on all the money flowing through the system. It has the opportunity, if you do it right, to connect with the member and actually influence and help and guide them as they're going through the system. So that didn't work well. Google Health. This is a little background on what we were doing there. So here's Oscar. We were going for 5 years now. We were founded back in the beginning of 2012. I think our 5-year anniversary is next week. It was started by 3 people that are technologists that have all felt that same pain. One of them had just had, the CEO now, had just had a baby, and they'd gone through all of the things going on with that, and then they got the claims coming in afterwards, and they looked at the EOB, and he could not decipher it. And this is a Stanford, Harvard. He could not figure out what in the world this EOB was trying to tell him. And he said, this is just busted. And he got together with a couple friends, and they said, we're going to do a tech startup that's going to go in, and we're going to change this. So how did they go about doing it? They start trying to change it from the inside out. This is the picture of the ecosystem that you've got. The insurer is actually at a very opportune point in the middle of this system. We are connected to everyone going on. Members and the providers are sort of the key partners and players in this that you really want to play well with. How do you take and build as a startup, starting with 3 people and then adding a couple of engineers here and there, build an insurance company from scratch? Oscar did this starting 5 years ago, and the only way to tackle this kind of problem is to First, look at all the pieces that are necessary. They're technological, they're ops related, and customer care, and then they're the apps you're trying to build that are going to interface with the members. What pieces of these do you build first? Well, what we did was we started with the member focus. We're going to start with the individual market, so you're starting off connecting to the patient or the consumer first. You build apps that are friendly, they've got a user interface that doesn't daunt them, but you start it from their very first touch. When they come to sign up, they come to your website, that's their first exposure to you as a company. They go in, they start learning about healthcare, about insurance. What we did was we painted a very simple, very clear picture of what's going on and how to step through it. And we started from that first web page touch to build a relationship with them. It isn't just beautiful web design. It's how you connect with them and encourage them to come back and get connected to you. Yes, intelligent web design and beautiful design helps with that, but there are other things that you need to be doing to complete that picture. We started off focusing on those apps, and then we built those apps and we built a thin layer around a lot of rented pieces that you can buy off the shelf or rent off the shelf. We had a TPA off in Ohio that was handling all the claims processing, claims review. They had the engines that were doing all this, and they're handling payments early on. Then we pulled the payments in-house, and they would route payment information to us, and we would run the payments. So you start off by building this whole thing. You put a bubble around all of the complexity and mess underneath, and you present a very clean picture to your end user, to the members, and then you start selectively replacing the pieces inside. So in 2014, we launched renting all these pieces and just having the user interface and this nice layer and a customer care team that was really focused on connecting with the members and starting to build a relationship. Then you start selectively replacing and rebuilding all of the technical pieces that are in the core of your system that really change and influence and differentiate what you're trying to do. You have to be very selective about this. You have limited resources. You're trying to grow membership. You've got a lot of operations and pieces to keep running. You have to be very, very clear and judicious about what pieces you go and replace at what point in time. This is back to 2016. 2 weeks ago, we finally replaced that TPA in the claims engine at the heart of the system. And now we quote unquote own that whole core engineering stack, top to bottom. We're still leveraging some services like Teledoc for telemedicine. But at the core of our business, we now run everything from the operations standpoint through the technical stack, front to back. So what are we trying to do in this ecosystem? Again, you have some patient out there and they have something wrong. What do they do today? Typically, they go to their friends and ask for a reference or ask for a PCP or a dentist or whatever that they like, or they go to Google and do a search and try to find that, or they go some random place. They go in, they hit the doctors, the primary care physicians or the hospital specialists and whatnot. They maybe have to go out to urgent care. They go through here. The insurance carrier gets pulled in off on the end and doesn't really have a chance to influence that at all. The picture we've shifted to is this. We've built a relationship with our members and worked the customer engagement side to where they look at us as their trusted guide through the system. We start from the beginning talking about the complexity and the difficulty in finding the right care and dealing with payments and whatnot, and we build a model where they will come to us and ask us for advice before going and finding something. It's not an HMO model. It's not a gatekeeper. You have to build a relationship where they want to come to you first, and we'll talk in a few minutes about what we're doing on the engagement side to encourage that. And then, of course, once you've got the product out there, you do the classic improvement flywheel where consumers start with you, you start building trust, you guide them through and you show them everything that you're trying to do is on their behalf. It's not to cause less expense down the road, it's to get them the best care, because if they will build that relationship, if they get that understanding about you as a company, then they start coming to you first, and you've got the opportunity to get them to the best physicians and make sure the right follow-up is done and so forth. And then you can take that to building a better product, you get more consumers, and you run the flywheel to continue improving things. So I wanted to touch on two pieces that we've learned that I thought might be relevant for this crowd in particular. One is what I've been talking about with member engagement. I'm going to go through a few examples, and then I'll close with two things on the data side of things and what value that brings to us and how we're looking at it. On the engagement front, you have to build apps that they're going to use. It's got to be in their pocket. It's got to be available very easily. But there's a lot of interesting learnings that you take out of that. Just doing a beautiful mobile app doesn't do it. We actually have a small fraction of our members come in through the mobile interface. And looking at the demographics and the breakdown for which segment of our population come in through the mobile interface versus the web, you get all sorts of interesting learnings out of that. But you build apps that have zero barrier. They come in, it's a very clean interface, and it's not daunting. They can go in, ask simple questions, use natural language searches and requests, and get back information and get guided towards various levels of care. Step rewards. This ties to the conversation that was going on in the panel just a minute ago. In your ideal world, you would love to think that encouraging your members to do steps is going to make them more healthy. And we actually have a rebate program where they do a certain number of steps a day. They get $1 off of their premium, and they can accumulate a certain amount of this during the plan year. And in an ideal world, if you had that member for forever and you could encourage them this way, by the time they were 60, they're going to give you less care there. I don't think that's where any of the value is. I think the value with this is it gets them thinking about your app as top of mind. It makes them think of Oscar first when there's something related to health. It's not that they're coming back and checking their steps and they're going to be that much healthier because they're walking right now. It's that when they do have something go wrong, they're then going to go and ask Oscar for help in figuring out what needs to be done. And that's shown on this side here. This is engagement on our telemedicine side, and engagement both with and without the steps tracker. So for people that are not using the steps tracker and not doing that day to day, there's 15% of that population back in 2014, up to 21% of the population that are actually using telemedicine during the year. And that's where they'll call in, they've got something wrong, we provide a free telemedicine service, they'll call us instead of going to the ER or the urgent care or even to their primary care physician. And I'll show you some information in a few minutes on how effective that is and why we want to encourage that. But if they are using the app, if they are using the step tracker, it's not that they're using steps and they're getting that rebate. Their engagement on the telemedicine side is ridiculously higher. It's tremendously higher engagement. We're up now to something like 30% over our entire population, and there are sections in our demographic that are up in 35 to 40% of the population that are actually starting to use telemedicine. And the really interesting stat from that is if you talk to the large companies out there, the 10,000 employees, 10,000 employee companies, and the telemedicine programs that they've put in place, typical engagement there is 2 to 3%. That's how frequently they can get their members to actually start using this service. And I'll show you in a second why that's so key. Did it again. Okay, another simple example on the user experience. This has to do with simple and clean UI, but it actually has to do more with building a personal relationship and a personal connection to the member. We put out our app. At first, we wanted to offer this concierge service, and we wanted to really encourage members if they had a question, they had something wrong, we wanted to encourage them to message our concierge team and ask us questions directly. And we had this up as our first nice, very clean, very simple, not intimidating, anything like that. But then when we changed to this, where it's essentially the same text, but we put in the pictures of the concierge team, we went from 5% to 27% of people that landed on that page actually messaged us, actually went ahead and asked the question that they were thinking about. So it's building a personal connection and developing that from the first moment that they touch your website all the way up to how they interact with the web, to the way your customer care teams respond and interact with them, so that they know when they're coming to you, they're asking a question of a person. And in this case, with our concierge teams, they're going to have the same group of people every time they come back to ask a question. They get their own dedicated set, so they actually get to know them. It builds a personal relationship. And again, it's getting them to come to us first when something's wrong, rather than any particular thing that's going on that we're trying to help them with. If they come to us first, we have the opportunity to help them and guide them through the system. All right, one more time. And then just providing rich functionality they can't get anywhere else. This is our doctor search panel. I'm not going to hang on this long. We're getting close to time. But we could get doctor discovery that it makes scheduling available immediately on here. You can go through and get detailed bio information around the doctors, being able to filter that and let them search based on how far from their house it is versus cost and things like that. Being able to expose all that and make that transparent is absolutely key to get them coming back and using your apps. And then we all have seen this picture before, but if you get your apps working together and you build that relationship, you get them engaging, your NPS goes through the roof. We actually have 3 times the industry average in the insurer world. And up there, I think Kaiser is the only insurer out there that has approximate NPS to Oscars today. And then one last one on the telemedicine front, have a variety of conditions out here. These are all conditions that can be handled through telemedicine some fraction of the time. The bars here show you what fraction of the time they can be successfully handled through a telemedicine call. Now, with our plans, if members call our telemedicine service, there is 0 cost to them, and to Oscar, the cost is $57. Now, if they have to get a prescription as a follow-on from that, there's a copay with that. That's separate. But for the doctor visit itself, encouraging them towards telemedicine, 90% of the time for acute bronchitis, you can do that with a phone call and a prescription done over the phone. You don't have to go to the ER or the urgent care like I did a month ago, or to your doctor. You can do it much more efficiently, much more cost effectively. And these have the same outcomes and same end results as having gotten out and gone to the ER and seen someone in person. And again, here are the costs you can see and the cost to the member. The pretty dramatic differences you can get if you can encourage people towards something's wrong. Let me get on the phone and call Oscar and talk to somebody that way. And then on the data front, I'll close with 2 slides here. There are two places I'd like to call out. Anytime you're trying to provide care for a patient, having that complete holistic view is absolutely essential. This is the holy grail. This is what we've all been talking about. This is where we have the challenges of integrations with EMR. The more you can pull that information together and provide that complete view, the more you can do in guiding those members, and the more you can do in proactive outreach. This is actually showing sets of members that have certain search criteria hits with, in this case, they're people that are depressant. And you look at the crosses of people that are depressive and have prescriptions but are not seeing the doctor, and these can raise alarms and highlights for the concierge team to do an active call out and reach out to those members and encourage them towards getting a checkup and seeing a physician. And lastly, one of the key sources of data that we've got in the insurance industry is the claims history. We get a huge volume, but they're all isolated atomic reports coming into us. The data is messy, and there are these funky arcane codes that you have to decode, and trying to figure out from looking at a claim what actually happened with some particular episode is an art in itself. But you get this whole volume of claims coming in on a member. What we're doing now is we're using machine learning to analyze that and coalesce it into coherent episodes. It can be from a knee operation where there were pre-tests and pre-visits to the doctor, and then the operation itself, and then follow-on rehab or follow-up tests with your physician. All of those were related to a knee operation. This grouper machinery will actually go through your claims history and pull an entire set together and show you, okay, for Alan's knee operation, here are all the sets of claims that were incurred during that operation. And by the way, he has hay fever or an allergy to dust. And there are these ongoing occasional visits through his lifetime that are related to that, and so forth. The grouper lets you pull that whole claims history together into actual intelligent episodes and conditions and such with a member that give you a much cleaner and accurate holistic view of the situation with that member, where they have something going on or they have something historical in their past. A physician looking at this grouper view gets a much cleaner overall view. But then the really powerful thing that you can take off of that is once you get a large body of these claims analyses done and you start looking at everyone that got an ACL replacement done in Manhattan in this certain time frame, you can start doing cross comparisons and look at outliers in terms of other claims and other treatments that were added in as part of that particular episode. You can look at differences between outcomes afterwards and whether there's any follow-up or complication after the procedures, and start doing these cross comparisons, and that gives you the ability to look at outliers, quality, and guide people towards the best places to get these treatments done. So there's a ton going on out there. We aren't nearly done with building what we want to build. The integrations are a beast. We all have these issues to tackle. And then there's the environmental things on the outside that we need to keep sort of blindered away. But there's huge opportunity in all of this. And every one of these blocks, every one of these barriers that we scratch down and pull together gives us an enormously cleaner and more powerful picture of what we're doing with our members. Thank you very much.
Well, thank you very much. That was very informative, and we're all going to enjoy using Oscar in the future in all sorts of different ways. So now, without further ado, I think we all we know what's coming next. If we could bring all of the teams up to the stage, if you guys want to come on up here, and you know, so MedStarter Ventures is a new thing, and the whole idea is that we find great companies that are killing it, that are changing the world. Companies like Triage, which was found during our AMA Crowd Challenge last year and went from one pilot in one hospital to 15 closed hospital contracts. We find them at the precipice of doing something, and then we listen to lots of people like you, not just the 42 people who turned in surveys, but everybody. So you come to our site, you click the buttons, we watch all that. 126 different data points, about 1 million data points, 126 different categories, about 1 million data points per crowd challenge. But it's all about finding these great companies and then getting them in the limelight, which is over here, guys. Okay, but you know, I couldn't do this without a great team behind me. I mean, not just Donna Cusano, who's amazing, but people like Dr. Sharad Mishra, Dr. Atul Kumar, right here, Dan Piakaj on our investment review committee, and a whole panel of MedStarter mentors who weigh in on all sorts of stuff from, are you going to actually use this doc, to, as a patient, do you think this would make you better? So people like Tiffany Peterson, who's in the crowd, you know, got behind Miami last year. Was that last year? Wow. And helped them really show the difference. Get over there. Anyway, I love entrepreneurs who take direction. Anyway, but in addition to Dr. Mishra and Kumar, et cetera, I also have Bruce Kaufman, who I think of as my adult supervision, because he's been there for us. He's CPA, MBA, does all the math, compiled all the data today, and actually is gonna. Are you done? Are you done yet, Bruce? He's still playing with. Okay, so he's gonna bring us the envelope, please. Yes, anytime. Can we get a drum roll? It's okay. It's more about it. We can't make any jokes about this. Bruce. Okay. Can't read this. So the winner is, and it was really close. It was actually a lot of great data collected, and just your all winners. We're probably going to put a number of you into our due diligence process, so we want to stay in touch and keep working on it. So there were two sets of data, though. There was you guys, everybody in the crowd, and then there are the judges. Didn't exactly agree. So I just want to say, before I say who the overall winner is, the crowd favorite was, once again, my friend Dr. Wilson. So big round of applause. But he's slightly lost out to the Metacube. So congratulations, Brad Hardaway. All right. So we're gonna put them into the due diligence process, and we're going to see what we can do yet. So that's it. Upstairs, now you'll see that all of these companies, as well as Triage, Miami, and Uplift, all have tables. So if you want to talk to those great startups, you can go hang out with them there. So Data Art, big thanks. PwC, big thanks. You guys made all this possible. McCarter in English, big thanks. And Health Tech Talk Live. Without you guys and without all of you in the crowd, this never would have happened. So let's have a great party, and I'll see you guys upstairs. If you go up the escalators, it should be on the right. It's there, right, Donna? Donna knows everything. Okay, that's it. Thank you, everybody, for coming. Have a great night.